Hi, good morning Patrick. My name is Linnea Krister. I'm your invigilator for the OET speaking session on the 5th of March 2020. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Patrick David.
And what is your candidate number, please?
My candidate number is 213333120.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
How do you explain medications, treatments, or healthcare situations without using a lot of medical jargon?
Patients have different educational backgrounds and understanding of healthcare and health terms. When I was a home healthcare nurse, many of my patients did not understand specific medical terms. So, I used terminology they understood. Instead of edema, I used swelling. For hypertension, I used high blood pressure. And instead of saying gastroesophageal reflux, I used acid reflux. I made sure they understood what I was saying by asking them to repeat what they heard until they could accurately repeat it in a way that made sense to them.
Describe a situation where you displayed teamwork.
In long-term care, the nurses often act as their own charge nurses, responsible for medication passes, WARMUP care, admissions, and discharges. Your day can be hectic. There was this one day when my coworker, another nurse, was having a chaotic day. He had a resident fall, a new admission, a discharge, and a heavy med pass. On top of all of that, he still needed to finish his skilled Medicare charting. I saw he was struggling and offered to complete his admission and start working on his discharge paperwork. He was so appreciative and was able to finish up and actually leave work on time.
What do you do when you don't know an answer to a patient's question?
When I start my shift, I go over patients' diagnoses and medications. If I'm unfamiliar with anything, I do quick research and learn what I need to know. It could be about signs and symptoms, prognosis, side effects of medications, adverse reactions, contraindications, etc. If I am still unsure, I ask a more experienced nurse. If I have questions about medication, sometimes I call the pharmacist and get clarification. Moreover, if I don't understand something, I don't try to guess. I'll contact my nursing supervisor or ask someone with experience. I don't let my lack of knowledge affect patient care.
Tell me about a time you dealt with an unhappy patient and family.
I once had a patient who had a new order for wound care. His bystander did not like how I dressed his wound. She thought that I should have used a different type of dressing. To ease her concerns, I reassured her I was following the doctor's orders. In layman's terms, I then explained the treatment order to her, step by step, and asked if she had any questions. She let me know that she was unaware of the order change, and thanked me for taking the time to explain everything to her in a way she could understand. I apologized that the new orders were not relayed to her, and let her know that I was available if she had any more questions.
How do you handle changes or updates to your workstation?
When my facility switched to electronic medical records, I learned the system easily and quickly. But I noticed some of the older nurses had issues adapting and struggling with the new system. I volunteered to help and was placed on a team to support the nurses' transition from paper charting to the new system.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your role play. Don't worry if I stop you when the time is up.
Hello, good morning, Linnea. My name is Patrick David, one of the registered nurses in the hospital. I have come to counsel you on postoperative pain relief and medication control. How are you feeling now?
Good morning. Nurse, I'm not feeling that better.
Oh. I am really sorry to hear that. May I know the reason, please?
My wound is still really painful.
Linnea, may I know you feel any changes in pain?
No, nurse. It is still the same.
Do you have any other concerns than the pain?
No, nurse. My major complaint is pain, and I am a bit worried, nurse. I feel this pain isn't normal.
Your concerns are really sensible. Perhaps I would like to make it clear that the pain you are undergoing is quite natural after the surgery. Try not to worry, Linnea. The pain is part of the healing process.
Okay. But it's quite severe.
Yes, I can sense that. It's just the second day after your surgery. I reassure you that the pain will subside gradually as your condition improves.
Okay, nurse.
Well, Linnea, I would like to know whether you have been doing any physical activity today?
No, nurse. I haven't been doing any physical activity. I haven't really got out of bed because I think it will make the pain worse.
It's quite natural, Linnea. If I were you, I would have thought the same way. Nevertheless, you are free to do some physical activities now.
All right, nurse.
I will explain to you the benefits of physical activities in the present situation.
That will be great. I wish to hear that.
I appreciate your willingness. Performing physical activity helps in alleviating pain. Exercises and movement done during rehabilitation can help to decrease swelling and prevent surgical pain from becoming chronic.
Oh, I see.
Beyond aid healing, doing physical activity improves blood flow, which brings more oxygen to the cells and keeps them rejuvenated.
All right.
Also, doing physical activities reduces the risk of blood clots. So I insist you do physical activities today onwards for these benefits.
Yes, nurse. I will start doing activities.
On these initial days, I recommend you to start with walking. I will arrange our physiotherapy team to pay a visit to you, and they will provide better activities suitable for your condition and age.
Thank you, nurse. That will be of great help.
Linnea, I would also like to let you know that IV morphine can be replaced now.
No, nurse. I don't want to do it. That's the reason why I am withstanding the pain.
I understand your concern. However, providing IV morphine after the initial surgery recovery period is harmful to your health. Also, it decreases your mobility and hence increases the risk of dependency.
Nurse, I will try to do some daily exercise, but only if I can stay on the IV morphine to make sure the pain is under control.
Linnea, I request your attention for a while. It is important to withdraw the IV morphine. There are high chances for an increased risk of constipation. Also, you may experience nausea, sometimes even vomiting and drowsiness. These will affect your recovery adversely.
Then, how can I manage my pain? I can't withstand this pain without any medications.
Your thoughts are considerable. However, only IV morphine is withdrawing from your medication. Instead, the oral dosage will be provided for you to withstand the pain.
Is it?
Yes, of course. I will explain to you the next step procedure.
Okay.
In the recovery process, each stage will be accessed, and accordingly, the medication regimes are being administered. Now, it's time to stop the IV morphine and switch to oral medication. Here, a review will be done and then the morphine dose will be determined. Hence IV morphine changes to oral morphine.
All right.
After some days, your condition will be reviewed again, and definitely, you will be much recovered. Thus we replace morphine with paracetamol. Linnea, I assure you that, till your pain subsides considerably, you will be provided with the pain medication. I hope you understand the procedure.
Yes, nurse. Now I understand it. I am glad that I can stay on morphine. But nurse, make sure I don't really see the difference between the LV and the oral morphine.
Definitely. Also, you will feel much more ease than now.
That's great.
Linnea, for your information, the benefits of oral morphine medication are, it is longer lasting, and is slower release.
Okay.
I advise you to speak to the doctor about pain relief on the next ward round.
Sure, nurse, I will definitely speak to the doctor.
All right. Thank you for your cooperation and for listening to me. I wish you a speedy recovery.
Thank you, nurse. That is the end of your OHT speaking roleplay. All the best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.